We'll get into the program now and start talking a little bit about what the last year has looked like. And I think we need to start by going through some of our objectives around our vision and our mission and our value statement. So about a year and a half ago, almost 2 years ago, we went ahead with a rebranding, and we looked at changing the name from York Central Hospital to Mackenzie Health. And that was fundamentally driven by the fact that we were building a second hospital. And when we consulted with the community, they wanted it to be called the hospital. So that's how we came up with Mackenzie Richmond Hill Hospital and Mackenzie Vaughan Hospital, and then the overarching brand being Mackenzie Health. And when we went through that process and we engaged the community and asked them what they wanted when we talked about things like our vision statement, they talked about the desire to be world-class. And it's something that we're striving towards, but they felt that there are many significant downtown institutions that have that world-class reputation, and why can't we have that in Richmond Hill and Vaughan? So this is sort of built into our vision statement, and it's fundamental to what we continue to strive towards. And the staff and the physicians and the volunteers who work at the hospital really do try to work towards that objective. When we looked at the mission statement, one of the things that came back from the community, and remember, we engaged about 400 to 500 people through this rebranding process in the community and within the organization. They talked about the desire to continue to improve services and care, and the need to be relentless in that pursuit of improving services. And when we talked about improvement, it wasn't just about what we did day to day in terms of the services, but it was also a belief that we had a duty to ensure that we created healthier communities. And that's the broader perspective of health promotion and health education and outreach services in the community, which we do very much of in Southwest York Region. When we looked at the values, the one statement that came out time and time again was the word empathy. And a real desire for our staff and our physicians to interact with our patients, not just as somebody that needed an intervention or a treatment, but as an individual, as a person, as a human being, and also reflecting that the families need to be involved in that episode of care and in that treatment. So that's sort of where we came up with some of the language. These are words. At the end of the day, we have to live this day in and day out, and that's our objective as we continue to evolve services and improve what we do day to day. Now, when we looked at some of the key objectives over the near term, and we did go through a strategic planning process in the last little while, one of the things that came out of that was the patient experience. And Tiziana Rivera, who's our Chief Nursing Executive, will speak to that in a little bit more detail. Again, our focus is to get people better or help them manage their illness, and that is something that our staff and our clinicians are trained to do. But there's a broader dimension of the experience, and that really leads to components of communication and the broader physical environment. So how do we ensure that the overarching experience beyond the clinical intervention is something that resonates with patients and really meets their needs? So this is a work in process. It's something that will take a lot of time to evolve, but it is something that is fundamental to our focus. Strategic growth, this is core to the Mackenzie Vaughan Hospital. We are struggling day to day to manage volume and growth at the current Richmond Hill site. The emergency department, the new department that we opened about 4 years ago, it was designed for just under 80,000 visits. We are already seeing 90,000 visits. So we see incrementally another 4,000 to 5,000 patients in our ED every year as an example. So clearly one hospital is not enough to support this growing community and the broader Southwest York region. So strategic growth and how we build services and how we leverage the opportunity of a second hospital, not just duplicating services 8.5 kilometers away, but really leveraging the fact that we can now build services that are subspecialty in nature because we have a bigger base with which to deliver care with. And we will be talking about that a little bit later with Dr. Herman, talking about the subspecialty services that we'll now be able to offer that otherwise you'd be going into the 416, into the downtown hospitals to receive, because again, we can start to attract those subspecialty physicians. Operational excellence. So this is core. At the end of the day, we are accountable, as Shafiq pointed out, to government. We have to run balanced budgets, and we have to be efficient. And the need to be operationally excellent is key to that. We went through a journey as an organization. About 3 or 4 years ago, we were facing some financial distress. We were running deficits. And we turned the organization around not by cutting services or reducing access, but by actually taking a lean approach to how we deliver care and eliminating waste, and in effect actually recovering the organization to the point where we've run multiple years of surpluses, and I'll share some of those results with you, but we are now in a very healthy financial position. But it's core to our business as we continue to grow. We need to be fiscally solid to manage the demand for services. And as the government evolves its funding formula, which is now funding us on a rate base for each procedure, we just have to be competitive to enable us to grow services. So one of the things that we do every year is we identify 3 objectives as an organization. We call them widely important goals, or WIGs, and the entire organization mobilizes itself around these 3 broad objectives. And many of them carry over multiple years just because they're big initiatives. So improving patient satisfaction, that goes to the actual experience of the care we deliver, but also the experience and the clinical outcomes. And for us, it's challenging because our business is predominantly linked to urgent types of care. So some of the downtown hospitals have a larger elective base where, it's more predictable. You come in for a procedure, it's planned, it's thought through. We have a huge amount of our volume coming in through the ED department, which makes it a little bit unpredictable. We can have anywhere from 230 patients go through our ED to 260, 270 on any given day. And it's that variability that makes it difficult. And we still have to find ways to ensure that we're meeting the needs of our patients. So one of the key areas of focus this year is to improve patient satisfaction in the emergency department. The other challenge, and again, the emergency department is the focal point here, is the waits. And the biggest challenge we have is waits for beds. So patients that come into the ED, that get admitted, and then need a bed, it's quite challenging. A lot of that, again, is due to the growth of volume and the need to move patients into other levels of care, as discharges are always difficult to come by. So we have what is called alternate level care patients. These patients need to be in a long-term care facility, in a rehab facility, in a chronic care facility, and sometimes those beds are not available. So it just backs up the entire system. But at the same time, we know we can do better to move patients through the system faster and reduce those waits. The last major objective is improving physician and staff engagement. And it's a pretty simple objective. Happy staff and happy physicians lead to happy patients. So we know that if our staff are more engaged and connected to where we're going and feel good about coming to work, they're going to be able to deliver that much better patient care to our community and to our residents. So I just wanted to share the financial position, and I think this is important because this was not easy to achieve. So you can see that, for example, last year we finished with a $10 million surplus, and our cash position is fairly strong. This is our balance sheet. So we have no debt, no deficit. So why is this good? Well, because of this positive financial position, we were able to put another $2 million into equipment without necessarily having to go to the foundation or another group. We were able to reinvest in ourselves to buy the needed equipment that we require for patient care. The other thing that we were able to do with this additional position was to invest in 2 programs that we have to grow. So we invested another $1 million in surgery and another $1 million in obstetrics. So we are growing ourselves. Obviously, we need more funding from government as well, but our efficiency is enabling us to deliver more care and better access to our community. So the last piece of my presentation is looking at growth, and core to that growth is the new hospital, and we'll spend a bit more time on this. This is a 5-step process that is required for any capital project through the Ministry of Health, and we are now in stage 3 of this process. There's another sort of element to this, and that's the role of Infrastructure Ontario, which is involved in delivering capital projects from the transaction and the implementation phase. So we have made huge gains in only a matter of about 3 years on this project, moving from stage 1 all the way into stage 3. And we will be breaking ground after we tender the project and get to commercial and financial close in 2015. So this is pretty rapid progress on a very complex project that requires a lot of key stakeholders having to come together. So we will be out to market on what is called a request for qualification in February of 2014, so that's only 3 or 4 months away. And we will be out on a request for proposal where consortia will bid this project, anywhere from 3 to 4 consortia that will design, build, finance, and maintain this hospital. That RFP will be issued in the fall of 2014, and then we will actually commence construction in 2015, and about 3 years to build that out. And our goal is to open the facility in 2019. And then this just gives you another dimension and view of those key dates. So what's core to this, and it's our duty as a public hospital and a facility that has to be aligned to meet the needs of the community, is ongoing consultation. We continue to have events like this. We have other sessions where we actually bring members of the community into what is called the President's Community Advisory Council. And it's a vital resource to give us feedback. And in fact, this presentation that you're seeing today, we did a trial run with the Advisory Council to ensure that we didn't get too busy with the hospital nomenclature and buzzwords, and more about ensuring that it would meet the needs of the community. So they are a vital resource, a sounding board, and providing us with vital feedback around the services we provide. We have a number of focus groups that deal with different types of segments of the market, whether it be seniors or moms. We have online surveys, and again, we encourage you to use our website to give us feedback. And more importantly, we're out at least 4 to 5 times a month, meeting with ratepayer groups, religious organizations, seniors groups. If you want us there, we'll come to your location and give you an update as to what's going on. And that enables us to hit numbers like 2,500 people being engaged, not just in the redevelopment of the Richmond Hill site or the growth of the Vaughan Hospital, but just understanding what's going on day to day in the hospital. So for the Vaughan project, how will it be funded? Well, we have funding support from the region. There is a levy that all of us pay as residents of York Region towards capital infrastructure for hospitals, and that obviously benefits South Lake, Markham Stouffville, and Mackenzie Health. We have a land contribution from the city of Vaughan. 80 acres has been purchased, again through a tax levy, and 50 acres of that will be provided to the hospital, both for its current bill and future growth. And what's also key is strong donor support. We will need in the range of $200 million of local share support from the community to enable us to build this hospital, both for the construction, 10% is funded by the local share, and all of the equipment, be that the medical equipment, the furnishing, all has to be funded 100% from the community. So that's, in effect, how we will continue to engage the community for local share support. So I couldn't stop without giving you a sense of what we've achieved. Obviously, I'm speaking very positively. Maybe I'm a little biased, but the reality is we've been acknowledged and recognized from a number of external parties. The most significant being Accreditation Canada. So they are a body that accredits all healthcare providers across the country, and we achieved the highest possible award, exemplary standing. That was achieved by getting a score of 99.7% on over 2,000 criteria that we were measured against, so we're very proud of that. One of our key staff members, Tiziana Rivera, received this award just a few weeks ago for nursing excellence. It's the Margaret Comack Award, and we were very proud of that. That's her leadership in the system nationally. Stroke distinction accreditation. We're only one of 4 hospitals in Canada to achieve this for both rehab and acute care services. So another demonstration of our high quality, and we are the regional stroke provider for all of York Region, so a key resource to the broader community. Healthcare Workplace Award, Gold Quality, we just received that a few weeks ago. Our lab accreditation, a key diagnostic service, 98.9% compliance on that. And we achieved a National Safety Award just a few months ago, I guess in June it was, and that's a national recognition of our infusion pump rollout and technology, which has greatly improved safety in the hospital. So that's just a snapshot of some of the things that have happened just in the last year and the recognition that we've received for that.